Hi there. Thanks for following the link to my video presentation here. This is currently the middle of May 2024. May is Vasculitis Awareness Month and it's also the month of my birthday. So today on my birthday, I thought I'll make a little video to try and describe what's been happening, give a bit of background and to ask you for your help. We'll jump straight into it. The condition that I've got is called vasculitis. What's that? Well, the name vascule, it's the blood vessels, and it's an itis, it's inflammation. And this nice diagram by the Sjogren's syndrome news, closely related to vasculitis, but it's a different thing. The diagram helps to explain things quite well, though. We have blood vessels that normally allow the blood to flow to where it needs to go, but in my case with vasculitis, my immune system attacks blood vessel walls, causing inflammation, which restricts the flow of blood and causes unpleasant things to happen. Now, vasculitis, it's an autoimmune disease. In my case, it's my immune system that's doing silly things. And this is where the immune system thinks that there's something wrong with the blood vessel wall, and it generates an immune response to attack that blood vessel wall. It can be found anywhere that you have blood vessels. So anywhere in the body from head to toe, left to right, all the way around, somewhere in the middle, on the surface, anywhere at all you've got blood vessels. It's a rare disease with up to, well, numbers vary, but something like 3,000 new cases per year in the UK, which probably means a typical GP could see one case every 5 years. And that's tied in with a British Medical Journal document that mentions these numbers. So that spills into a very small percentage of the population, 1 in 20,000 people per year. It's a rare autoimmune disease, but it has 18 named variants, and they're grouped by the size of the blood vessel involved, whether it's large, medium or small cell, and by the organs impacted. Could be your kidneys, could be your brain, your lungs, your heart, your skin. And there's much more information about this. It can be obtained from Vasculitis UK fact sheet if you go to their site. Now, I guess we're pretty lucky. NHS expertise. Here in the UK, we have one of the most experienced authorities on vasculitis, Professor David Jane, who can be found at Addenbrooke's Hospital. Works also as part of University of Cambridge. Scotland itself, we have several recognised experts in the successful treatment of vasculitis. Here we can see Professor Neil Basu, Glasgow University. And it's an old slide, Dr. Niraj Dawn, I believe he's now Professor Niraj Dawn, who is part of NHS Lothian. And we've got sites with NHS expertise, Edinburgh, Glasgow, Aberdeen, Dundee, to name a few. There's one or two others, but there's also gaps. Now, a big part of the battle is being diagnosed, but once you have been diagnosed, well, you would think after the disease has been named, that's it, everything's fine. But no, you've got a short-lived sense of reassurance. Now the postcode lottery starts. If you happen to live in the right area and you happen to have the organs that fall under the attention of nephrology, the kidney doctors, or rheumatology, you may be seen by one of those specialists that I mentioned earlier. If your health board is not in one of those areas, the consultant controlling your care has to figure out a treatment plan for you. Now, experience gained from potentially one case in every 5 years is not too reassuring. Time is ticking, permanent damage is accumulating. So if the consultant's being kind, they'll maybe try the least dangerous treatment first and then wait a few months to see the response. But vasculitis doesn't wait, it keeps progressing. Now, at the specialist vasculitis clinics, well, they could be treating 2 or more patients per week. It's not a lot of patients, but still much greater level of experience than probably one case every 5 years. Specialising in vasculitis, the consultants keep up to date with the treatments that work and, of course, the ones that don't. They share information and they take part in research. And all of this increases the overall experience in the treatment of the condition. They follow internationally recognised treatment guidance without delay. They understand that delays with vasculitis can be bad. Here's the strange thing: you don't get a consultant of vasculitis. The consultant controlling your care will be a specialist in the organ that the problem has shown up in. But remember, vasculitis is in your bloodstream. It's travelling everywhere in your body, through every organ. It stops off at some undefined location, starts to cause problems with the blood vessels, which then starve the oxygenated blood supply to an organ, and then that organ gives you symptoms that the consultant will then try and treat. Now, the consultant may never have successfully treated vasculitis. The consultant that is responsible for the organ that the condition is presenting in, he may never have successfully treated vasculitis. They may finish their career in maybe 20 or 30 years at never having successfully treated a vasculitis patient. It's a rare disease. Now, this leaves very little hope for a successful outcome. Without being treated in a vasculitis clinic, recovery chances are poor. Creating a specialist clinic where there's no demand makes no sense. It's a complete waste of funds. So vasculitis patients should be allowed to be treated in a vasculitis clinic without needing to create mass public support first. Now, vasculitis, well, that is, as many of the vasculitis patients say, it's the disease that keeps giving, and it's true. Remission is seldom permanent with vasculitis. Once you've been treated and you're in remission, it's very seldom is it permanent. Relapses are common. After one successful treatment, well, you would think that rapid treatment would be available when a relapse arrives, but it's simply not the case. Once remission has been confirmed, a relapse treatment plan should be set in place. Relapse will happen. It will. The local GP could play a part in starting the treatment plan, while the consultant is preparing other things in the background. Delays in treatment lead to an accumulation of permanent damage, disabilities, and the need for benefit support payments. No one wants to do that if they don't have to. Longer treatment durations as the disease has got a stronger hold, which means more cost because it's going to take longer to treat. And it's going to be more difficult to treat. Loss of workforce productivity, potentially no longer able to do the same job. And it's a long-term drain on the NHS due to permanently damaged organs. So, well, there is a solution that's already available. So what is needed to fix the problem for everyone? Well, we already have the experience in this country, and it's in the NHS. So that's good. Case levels are not high enough for specialist treatment centres at every hospital. That's acceptable. But a procedure or a rule that states once diagnosed with vasculitis, the patient's care must be under the supervision of a vasculitis specialist care centre. Must. The medications, they're already available. Steroids and immunosuppressing chemo drugs, they're very freely available within the NHS, but they are only most effective when administered in a timely fashion, in the correct proportions, doses, over the correct time spans. An experienced vasculitis specialist needs to be in control of this part to give the most effective outcome. Or you can end up, a bit like me, with the patient in a continuous remission relapse cycle that they're never going to get out of, gradually getting worse and worse each time. And finding themselves with a permanently immunocompromised system, meaning they've got to avoid densely populated places and can't get back into the office. And the other thing to remember is once in remission, the disease will return. So you've got to plan for its return, be ready with a treatment plan put in place. Doing this will save lives, it'll limit permanent disabilities, it'll reduce the drain on the NHS, and it'll keep people in the workplace. In my case, the disease is showing up mainly in my sensory nerves. My right foot and leg up to the kneecaps. Sensory abilities are fading. My right and left hand sensory abilities are fading. And currently a patch across my back that's spreading. Now, the GP, the general practitioner, has no choice and he must send me to a neurologist because this problem that's in my bloodstream is stopping at my sensory nerves. And it's neurologists that know about sensory nerves. But neurologists don't have experience with vasculitis. I found this quite difficult to explain to people for a while, but then after a number of freedom of information requests, looking at the number involved, it became obvious they just simply don't see enough patients. Vasculitis clinics know exactly how to treat the condition. They know what works, what doesn't work. They know how quickly to treat. The staff research the conditions. neurologists don't. It doesn't make sense for a neurologist to take the extra time involved to study a condition that they may only see once or twice in their career. It doesn't make sense. And in my case, with neuropathy, neurologists typically allow neuropathy to run its course, as generally it's linked to other conditions and it's not that treatable. So, as a general rule, they believe it's just not that treatable. Although in my case, it's completely treatable, and this was demonstrated both just before and then during the lockdown periods, where I had managed to be seen in a vasculitis clinic, was treated successfully, found to be in remission without the need of any more drugs. Then lockdown appeared, and I managed to work my way entirely through lockdown, gradually recovering more and more, um, until February 2023, where a big relapse came back, and I've been stuck in this cycle of incorrect treatment and gradually getting worse. So, what will fix the problem for me? Well, for me, the solution has got two parts. First of all, short term, is an executive decision at NHS Forth Valley, and this would be to allow me to be released into the care of an NHS location that has specialist vasculitis treatment expertise. That's the first main part, just to stabilise the condition. Secondly, long-term solution would be an NHS policy change between the board medical directors and potentially Scottish Parliament health ministers. But really, I can work on this after some initial treatment begins. At the moment, it's really need to try and get some treatment going to halt the progression, and then we can try and fix the underlying problem, the root cause. So after a lot of investigating, I've now found out that NHS Forth Valley policy is that you need, now concentrate here, you need an out of area referral request approval from the Public Health Department within NHS Forth Valley. And NHS Forth Valley's policy is that only a consultant can create this, and that would be only a consultant within NHS Forth Valley. GPs are not allowed to create one. GPs are allowed to create a referral to send you to a consultant inside NHS Forth Valley, even although the GP may understand there's no expertise within NHS Forth Valley. The GP is, even although you have identified a consultant in another health board who has expertise, who is willing to see you, even though you've managed to identify that, the GP is not allowed to create a referral to send you there. A change in this policy is needed to correct for people like me that find themselves stuck in a no man's land with no clear path to treatment. Now, the guy down the bottom here, Dr. Graham Foster, he's a member of the board and the director, he's a member of the NHS Forth Valley Board, and he's the Director of Public Health within NHS Forth Valley. It's his department. He should be able to make an allowance for my unusual case as it is his department that's responsible. Public Health Department in NHS Forth Valley are the ones who approve an out-of-area referral request, and Dr. Graham Foster is the Director of Public Health. So, I need your support. I need you to help raise awareness by signing my petition. And in the first instance, asking NHS Forth Valley Director of Public Health, this guy, Dr. Graham Foster, to make an executive decision that will allow me to be referred to any other health board that's got vasculitis treatment expertise. Now, as a caveat, this must be without any interference from neurologists that have no real expertise in successfully treating people with my condition. I'm currently stuck in a permanent lockdown. You guys are all back at work. And I'm stuck in this part here. I need your help. Please help me to be released from this nightmare. Sign my petition, set me free. Okay, quick update. If you have found this video and it's not came from the petition, head over to change.org and search for Alan Diamond. That should take you to where the petition is. Sign my petition. I need your support. Thanks.